Addressing Hawaii's mental health issues is a top priority this month as healthcare entities like HMSA and government leadership continue to pull this once taboo subject out into the open.
I'm Dr. Kenny Fink, the Director of Health, and I'd like to thank all of you for coming today and participating and showing your support, not just for today, but for the entire month of May. So today is a wonderful event with our partners and other community members, all here to show their support for Mental Health Month. We really want people to know that it's okay to not be okay. It's okay to talk about mental health, and it's okay to ask for help. And that's why all these people are here today.
According to the latest data, more than 1 in 5 adults live with a form of mental illness.
Mental health is nothing to be ashamed about. We need people to be healthy mentally as well as physically. It's time to take mental health out of the shadows, acknowledge the fact that people are suffering, and hopefully with fairs like this, we could show that the community will support those who are suffering from mental health.
The prevalence here is very high compared to other states as well. And one of our biggest problems is the number of people who have a mental health condition who are not receiving care. We need to better understand the reasons why they're not so we can address them.
For example, close to 20% of children and teens have a mental, emotional, developmental, or behavioral disorder. But only 20% of those kids who need services actually receive help.
Legislators have made mental health a priority for the last 4 to 5 years. There really has been a focus, especially coming out of the COVID-19 pandemic. We know that adults are struggling. We also know that youth are struggling. So this legislative session, the legislature has invested money in systems of care. We know mental health is healthcare. So we have a lot of resources going into the hospitals, into mental health programs.
HMSA's purpose is to improve the lives of our members and the health of Hawaii. And that all starts with really good mental health. You really can't even start to think about physical health and well-being unless you have taken care of your mental well-being. I think the great thing about this month is it shares about how we can view improving mental health in our communities at the individual level, at the macro level, where businesses, communities, government, everyone that influences how society lives comes together to pay attention to mental health.
If you or someone you know are experiencing a mental health crisis or looking for mental health resources, please call 988.
I just want to appreciate HMSA, along with all of our other partners, who are doing all that they can to make sure all of their members in our community is receiving the mental health care that they need.